Hi there, my name is Dr. Ajay Seth. I'm a consultant in sport and exercise medicine, and I also work for British Tennis as a sports physician. Today, we're going to be discussing common injuries in tennis. Tennis injuries can present in a variety of different ways and can affect anything from the upper body to lower body. Most people will present with tennis elbow, which is pain around the outside of the elbow and pain in the forearm. A lot of the issues in tennis tend to occur because of poor technique and poor biomechanics. With elite tennis players, the type of injuries they receive tend to be much more overuse around the hip and groin and lower limbs, and less in the upper limbs and the elbows and forearms. Elite tennis players have a very strict strength and conditioning program to make sure they are strong enough to place the physical demands of the sport on their bodies. It's really important to try and emulate that with our tennis game, making sure we get in the gym, try to get strong and try to get more robust so we get less injured on the court. What equipment should I use for tennis? Your choice of equipment can have profound effects on whether you get injured in tennis. For example, playing with a racket too heavy or too light, a wrong string tension, or a grip size too big or too small can all have knock-on effects through the arm and into the body. Having the correct footwear for tennis is also very important. Having shoes that provide lateral stability, so making sure you don't roll your ankle when you're changing direction, for example, is also very important. And also thinking about the type of surface you're playing on, as clay court shoes may differ from hard court shoes. If you have an injury from tennis that just isn't improving with simple measures such as rest or icing, it's very important to get a full clinical history and examination to understand what the exact nature of the injury is. Again, most of the time, improving technique and improving equipment can really help reduce your symptoms and improve your game. Tennis injuries can either be acute or chronic. For example, an acute injury may be that you've fallen over, or you've tripped, or you've sprained something on the court. Actually, most of the injuries we see in tennis are chronic overuse injuries. So there's been a lot of repetitive motion going through the joints and tendons. As mentioned, inflammation around the outside of the elbow, called tennis elbow, is the most common amongst recreational players. To improve that, again, you need a proper strength and conditioning rehabilitation program and sometimes further interventions such as shockwave treatment or injection-based therapy. Other overuse injuries can include hip pain, groin pain, and also lower back pain.